9:32 into your health this morning. Just as children have unique health care needs and can benefit from seeing a pediatrician, older adults have the same needs as well, and they may benefit from seeing a geriatrician. But the big question is, when? And how do you know when it's time to see one? How do you find one? So to clear it all up, Dr. Arbaje from Johns Hopkins is here. Thanks for coming in.
Thank you for having me.
All right, so why is this a need for older Americans and older people in general, I guess?
Well, older adults are living longer and longer, as you know, and it becomes really important to have someone coordinating care because as you get older, you develop more health care problems, you see more doctors, and you start taking more medications. So it's very important that someone is taking care of watching all of those things and keeping track of it. So that's what geriatricians often do, and we specialize in keeping older adults as independent as possible.
It's hard probably for an individual to know because you always hear, oh, you know, 70's the new 60, and since age is changing for a lot of us, how do you know when it's time?
So
Are there signs?
Yes, there are, and it's very important to think about that there's not a particular age when you need to see a geriatrician. It's more based on your individual needs. So here are some questions you can ask yourself to see if you need to go to a geriatrician. One, are your health issues starting to impact your day-to-day life more than it used to? Are you having more trouble coordinating your care, managing all these doctors and medicines and tests that you have to take? Are you having any trouble with that? Are your family members starting to feel more strain in taking care of you? Are they feeling more stress? And then finally, are you starting to face some of the issues that older adults typically face? For example, hearing problems, visual problems, problems controlling your urine or holding in your urine, problems with weakness, dizziness, and falls. Those are some of the issues that we tend to focus on, and also problems with your memory.
Somebody who may have those issues might say, but I have a general practitioner. So why is this a better option?
So it can be a better option. It just depends. So if you're generally healthy and happy with your primary care doctor, there isn't a need to go seek out a specialist at that particular point. But if you're starting to feel overwhelmed with all the different illnesses, if you're starting to feel like you need someone coordinating all the different care, talking to your nurses, your physical therapist, your case managers, your social workers, that's where we as geriatricians can come in and help give an overall big picture. And we often work with the primary care doctor and other specialists to help coordinate your care.
How do you find a geriatrician?
So we're very fortunate in the Baltimore area because there are many geriatricians in this particular area, which isn't true across the country. Most of the big hospitals in this area have geriatricians who are affiliated with them. What I would say is to first start by looking at the American Geriatric Society. There's a website that you can go to request an online referral. It's www.healthinaging.org, or you can call their referral line, which is an 800 number that you can call to ask for a referral. Now, Geriatrics at Johns Hopkins is based on our Bayview campus, so you can also call us there if you need a referral.
Okay, great. We'll try to get all that information on our website. I appreciate you coming in.